IEM Test Selection Tool is a resource developed by the Center for Human Metabolomics. It assists clinicians in selecting the most appropriate metabolic and pathology tests for patients with suspected inborn errors of metabolism and generates a supporting referral letter based on the patient's clinical presentation. Let's open the tool. The first field requires your email address. This is important, as a copy of the completed form will be sent to you once you submit it. You are then presented with two options. Option A, the full comprehensive test selection tool. Option B, for when you already know which tests to request and only want to provide additional clinical information. For this demonstration, we will select Option A. After selecting Option A, you will see a list of clinical categories and groups. These are broad groupings, designed to help you quickly identify the most appropriate test panel based on the patient's presentation. For this example, we will select metabolic encephalopathy. Once selected, the tool will display both routine pathology tests and specialized metabolic tests. Each test includes a code, which provides important information about sample collection and handling. For example, a venous blood gas is labeled BG. If you check the code, you will see that it requires a capillary tube or syringe and must be transported on ice. Some tests also include a numbered legend. For example, fasting insulin may have a 1 next to it. The legend indicates that this test and others marked with a 1 should only be requested if hypoglycemia is part of the clinical presentation. It is important to review the legend to ensure appropriate test selection. You can now customize the test panel by deselecting or adding tests. For example, if your patient does not have hypoglycemia as part of the metabolic encephalopathy, you can deselect the relevant tests. Similarly, urinary amino acids marked with a 4 should only be requested under specific conditions, such as hyperammonemia, renal tubular acidosis, pellagra-like skin lesions, or urolithiasis. If these are not present, you can deselect this test. By refining the selection, you are left with a focused and clinically appropriate test panel. The next step is to provide clinical information. This is structured into 6 sections: clinical features at presentation, relevant medical history, radiology findings, current treatment or feeding regimen, antenatal and peripartum history, family history. Please provide as much relevant detail as possible, as this significantly improves diagnostic interpretation and our ability to make further recommendations. A critical next step is to add the Center for Human Metabolomics as a copy doctor. Due to POPIA regulations, we do not automatically receive routine pathology results unless we are included as a copy doctor. These results are often essential for accurate diagnosis. To do this, select a pathology laboratory of your choice from the drop-down menu. Then click Consent to add Copy Doctor. You can now sign and submit the form. A copy will be sent to your email address. You can then print the document and send it with the patient, together with the pathology requisition form for sample collection. Finally, after printing, please ensure that the patient considers providing additional consent. First, consent for Northwest University to request additional information or testing for diagnostic purposes only. This applies only where no additional cost will be incurred. If further testing may result in additional costs, separate consent will be obtained in advance. Second, consent to be contacted regarding potential research participation or opportunities that may improve diagnosis or care. Once the appropriate consent options have been selected, the patient can proceed to sign the form. This completes the test selection process.